Okay, welcome. This is my video presentation for Public Health 3 on where I want to practice. So if we go down to these first few images here, the first one is actually going to be the place I'm choosing to practice, which is going to be Vernal, Utah. So if you can see the map of Utah here, it's not a great map, but it works. Okay, most people living in Utah live in and around Salt Lake City. We call it the Wasatch Front. I believe about 80% of people who live in Utah live in this general area. Where I'm going to be working at is a city called Vernal, which if you notice is very east of Salt Lake City. It's below the border of Wyoming and right next to the border of Colorado. And it's a pretty rural area, so it takes about 3 hours to drive there from Salt Lake City. And Salt Lake City is the biggest city that's near Vernal, so it's pretty rural, very isolated, but I love it. It's actually amazing. So if you go to the second image, this is actually what Vernal looks like. If you're driving down through downtown, you got the beautiful mountains in the background. We call it Split Mountain, and then you got a few different cars, a lot of trucks. And I'll expand more about that, but it's a very rural, rugged, blue-collar community. The next three images I'm going to show you here. First image is just the backdrop of the Green River, which runs right by and through Vernal. And there's some beautiful landscapes that are here. Once again, another one here is just people rafting through the Green River. And the next one after that is going to be Fantasy Canyon, which is another cool place that's right by Vernal. So if you look at all these images, this is just kind of what Vernal's known for here. And I'll link a few pictures of me too with me hiking. And if you look, I look completely different than I do now. Here's a picture of me now compared to me back then. So if you notice, I still have hair back then. I don't have a beard, so it's just completely a different look. The next two images I want to show you here is what Vernal's really known for, which is dinosaurs. And I always tell people who want to come out to Vernal, check it out. I'm like, hey, we got the best dinosaurs. You want to come out here? We have a place called Dinosaur National Monument, so we get a lot of tourists to come out and check this out. The first one here is the Dinosaur Quarry. It's the biggest slab of rock with dinosaur bones in the entire world. What I mean to say by that is there's hundreds of fossils just in the side of this mountain here. And it's pretty cool. You can go up to it. You used to be able to touch it. I'm not sure if you still can. Another thing we like to do is we have a lot of dinosaur statues throughout town. So here's our picture of our good old boy T-Rex here. He's dressed up in a cowboy suit. That's because we have a big rodeo here that's really famous. I'll link a picture to that rodeo right here. And it's one of the biggest rodeos in Utah. We get a ton of people coming out through this. And that's also a big touristy thing that happens here. So most of our tourists come in the summer, and once again, it's just a really cool place to go visit. I recommend it highly to anybody who I talk to. All right, cool. Next thing we're going to be talking about is the demographics of Vernal. So in 2021, what I found is there's about 10,000 people living in the city. Now, that doesn't include the surrounding area. So the surrounding area's got Vernal, and then right next to it, you got a city called Roosevelt, and you got some other cities and people living in more rural parts that aren't considered Vernal proper. But the metro area is about 40,000. So there's a lot more people living outside of the Vernal city proper than inside the city. The median age of Vernal is about 30 and a half. It is pretty young, so it's probably because of a lot of that blue-collar work that we get here. The 2021 median income household for income was about $50,000 per year, which is significantly less than the Utah average, is about $80,000 per year. So it is a bit poorer of a community than you would say in going out to Salt Lake, Provo, Orem. The race demographics of Vernal are about 81 to 82% white. Hispanic is about 9%, and Native American is the next biggest demographic with about 2.4%. The marriage rate in Vernal is about 45%, which that means people who are eligible to be married, about 45% of them are married. So it's a pretty big community in terms of marriage, and people like to have families. In fact, you go walk throughout town, you'll find a lot of kids running around. I'm going to skip over this mining one down to the Church of Jesus Christ of Latter-day Saints. So part of the reasons why there are so many families here, there are a lot of kids, is because of the religion in the area. So the biggest religion is the Church of Jesus Christ of Latter-day Saints, otherwise known as Mormon, or we like to go by as the Latter-day Saints, or Church of Jesus Christ of Latter-day Saints. So that's about 62.5% of the population here in Vernal are members of this church. So it's a very, very big community in Vernal. Now, going on to the biggest part of what Vernal's known for, and that is for industry. So we have a lot of oil field workers out here. And I put it's mining, quarrying, oil, and gas extraction is what I put. And that's about 13.1% of Vernal. It's about, the mining, quarrying, doing a lot of blue-collar work. Another part that I saw here that I really liked was the general health condition. So 53% of Vernal was averaged to be healthy. And the Utah average was about 57.4%. So it is less, a little bit less than the Utah average. And I think that also has to do with, number one, the blue-collar work we have here. Number two, the not as much access to healthcare or healthcare providers out here. And three, I think it's just a rural community, so sometimes people on average don't like to exercise as much. So it was very interesting to see that. And other healthcare conditions too were a bit less than the other parts of Utah. So everything basically all across the board was lower in terms of the health. So that's one of the reasons I want to practice here too, is because, well, one, I'm from this community, but two, I want to help raise the standard health in Vernal. So how do I know this community? That's a great way to bring this up too. So you're going to see a lot of old pictures of me. I apologize for that. A lot of them I still have hair, so I look completely different in these old pictures. But I graduated here from Uinta High School, which is the high school in Vernal, Utah. In 2012, I played soccer in high school, made a lot of friends. One thing I love to do in Vernal is hike around. There's so many cool hiking spots. So here's another picture of me hiking. And this is just right off the road. So you can just literally go off the road, go hike up to this giant rock, which is kind of like the rock in The Lion King. And it's amazing. And another way I know this community is through the religion. So I am a member of that Church of Jesus Christ of Latter-day Saints, like I mentioned before. Here's a picture of me and my friend in front of a temple, which is our religious buildings. As part of this community, what I do is I'm in part of the bishopric, which means I get to interact with a lot with people in my area that are coming to church, that need help, that are in need of guidance, or that need there's a lot of things you do, and I can't get into all of it right now. And I love serving, and so it's a huge part of serving. So being part of this church, nobody gets paid. So one of the cool things about it is it's just service, full-time service. So now let's scroll down to the public health page. So here is the websites that I found here for the public health department of Vernal. There's not one specifically for Vernal, but it's called the Tri-County Health of Utah. So it covers 3 counties in Utah, which is going to be the metropolitan area of Vernal. So that's about the 40,000 people. So if we go through, I listed a few of the things on here that were the main concerns of the website, or ones that just kind of stuck out to me. So the first one that I saw here was the local disease and virus watch. So if we go down to that and look, one thing that's breaking out right now is influenza. So the Department of Health is really looking into influenza, helping people recognize the signs and symptoms, how it's spread, what you can do. Another one too that I found was interesting was COVID-19, especially where that happened pretty recently. Right now it says there's no regulations concerning COVID-19, but if there is anything else about it, this would pop up here. The last one that I put on here was dealing with the new business renovations. It'll talk about tobacco shops. It'll talk about fast food places. It'll talk about other businesses with tanning, cosmetology, tattoo parlors, just a lot of things and what they should expect and if they need a permit to do a lot of that stuff. So it's a lot of cool information you go through here to the public health needs and what they are requiring. In fact, what I found was interesting is when I was doing research, I didn't find a lot talking about the obesity rate and how unhealthy everyone out here in the county is. But what I find really interesting about that is there is a lot of needs and disparity when it comes to that in this area here. So that's one thing I definitely want to target, and maybe I'll contact the people who run this website and maybe see if they can put something up about how unhealthy it is out here in this rural community. Now let's go to talk about chiropractors in this community. So in Vernal, there's about 3 different chiropractors that I know. That's all that practice here. So I know I've talked to all of them personally, so I know them pretty well. There's 5 in the metropolitan area. So there is a lot of need here for chiropractors, a lot of growth. And what I want to do with my future practice right now is I'm looking into sports and sports medicine and dealing with a lot with athletes. And there's no one out here in this area that does any of that stuff. So I know I'd have a big niche, a good market to go into, and I'm very excited about it. Very excited to help give people education about how they can raise their standards of living. And this last picture here that I want to show is just the references I used for the articles and the pictures today. The first 6, 7. The first 7 of them are just picture areas. And so you can feel free to look through all those sources and everything else that we have on there. But thank you again for listening. And yeah, all right, cool. Take care.